Hi, my scholars. Welcome to today's class on the median nerve. So the median nerve is the main nerve of the front of the forearm. So by the way of introduction, so the median nerve is the main nerve of the front of the forearm. So it's the main nerve of the anterior compartment of the forearm. That's what it means. It has other names. It is also called the laborer's nerve. Also called the laborer's nerve. Laborer's nerve. And it is also called the eye of the hand, or the peripheral eye. It's also called the eye of the hand, or peripheral eye. So these are other names for the median nerve. Why is the median nerve given these names? Okay, it's called the main nerve of the anterior compartment of the forearm because it supplies the long flexors of the anterior compartment of the forearm, with the exception of flexor carpi ulnaris. So it supplies the flexor digitorum superficialis, supplies the flexor digitorum profundus, it supplies the flexor carpi radialis, and the long flexors on the anterior compartment of the forearm. So why is it known as the laborer's nerve? It's because it supplies the long flexors on the anterior compartment of the forearm, which are very much responsible for the coarse movement of the hand. Coarse movement of the hand, the movement of the wrist joint, which has enhanced manipulative activities. So the laborer's nerve, because it enhances what? Coarse movements of the hand. It supplies the long flexors that are responsible for the coarse movements of the hand. So why then is it called the eye of the hand? It is called the eye of the hand because the median nerve supplies the pulp of the thumb and the index finger. It supplies the pulp and of the index finger and the thumb. So because it supplies the pulp of the index finger and the thumb, you use it to feel the thinness of a particular material. You use it to feel the thickness of things, okay? Even without using the eyes, you can tell about the thickness, a sort of sensations using the pulp of the fingers. Because the median nerve innervates these points through its cutaneous branches. And that is why you call it the eye of the hand. So it can be able to tell about the thickness or the thinness of a material by a mere feeling using the pulp of your digits. Which digits? The thumb and that of the what? The index finger. Very, very important. So these are other synonyms for the median nerve. The origin of the median nerve. How does it take origin? The origin. Okay. So the median nerve arises from two cords of the brachial plexus. So it arises by the union of the lateral root and the medial root. So the lateral root of the median nerve is coming from the lateral cord, while the medial root of the median nerve is coming from the medial cord of the brachial plexus. This comes from the medial cord of the brachial plexus. So the lateral root has nerve roots C5, C6, C7. So it has three nerve roots: C5, C6, and C7. While the medial root has C8 and T1. Okay, so these two roots will join. These two roots will join. Okay. They are going to join either anterior or they will join lateral, okay, to form, or they will join lateral to the third part of the axillary artery. So it's either they join anterior to or lateral to the third part of the axillary artery and form what? And form the median nerve. So we have been able to establish that the median nerve has all the nerve roots of the brachial plexus, and it is because of the union of the lateral cord, the medial roots, and the lateral roots from the medial cord and the lateral cord respectively. And once these roots unite, they are going to unite either anterior to the third part of the axillary artery, or they unite lateral to the third part of the axillary artery, and they will form a nerve. That nerve is called a median nerve, the eye of the hand, the peripheral eye, the laborous nerve. And that is hyoid, okay? So their point of union is actually Y-shaped. So you have a Y-shaped union, of the lateral roots and the medial roots. So usually the medial root of the median nerve crosses, okay, anterior to the what? Axillary artery, and then unite to the lateral roots. So just such that the median nerve is either formed on the lateral aspect of the third part of the axillary artery, or it is formed anterior to the third part of the axillary artery. That is high yield, okay? So after its formation and origin, what happens? In order to understand the cause or how this nerve moves, okay? So within the axilla, this nerve lies lateral to the third part of the axillary artery. So in the axilla, it lies lateral to the third part of the axillary artery. It lies lateral to the third part of the axillary artery. Okay. It will leave the axilla to enter the anterior compartment of the arm at the lower border of teres major. So at the lower border of teres major, what happens to the axillary artery? So it enters the anterior compartment of the arm. So anterior compartment of the arm. So within the anterior compartment of the arm, at the upper part of the anterior compartment of the arm, what happens? This nerve right here called the median nerve is going to lie lateral to the brachial artery. So median nerve lies lateral to the brachial artery. Then what happens at the mid-arm level? Okay, at the mid-arm level, which corresponds to the level of insertion of coracobrachialis, the median nerve is going to cross this. So it's going to cross from lateral to medial. So the median nerve is going to cross the brachial artery from lateral to medial, okay? And what happens? It descends to the cubital fossa. It descends to the cubital fossa. And once the median nerve descends to the cubital fossa, it forms the most medial contents of the cubital fossa. Remember what that mnemonic was? So we called it the MBBR. So the median nerve is the most medial content, while the radial nerve is the most lateral content. So the median nerve is lying medial to the brachial artery and to the tendon of biceps brachii muscle. And this is how it achieved that relationship. So it descends to the cubital fossa as the most medial contents of the cubital fossa. So what happens, okay, is it is going to leave the cubital fossa by passing between the two heads of the pronator teres. So the median nerve leaves cubital fossa by passing between two heads of pronator teres. And once it leaves the cubital fossa by passing between the two heads of the pronator teres, it enters the anterior compartment of the forearm. So within the anterior compartment of the forearm, what happens to the median nerve? Okay? The median nerve is going to lie between, okay, the flexor digitorum superficialis and the flexor digitorum profundus. So it's going to lie between flexor digitorum superficialis and the flexor digitorum profundus. Okay, so and throughout the length of the forearm, down to the mid-arm level, the median nerve is going to lie under the cover of flexor digitorum superficialis. And at the level of the wrist, okay, the median nerve emerges from the tendon of flexor digitorum superficialis, and it comes to lie under the cover of the palmaris longus. It lies under the cover of the palmaris longus muscle, such that the flexor digitorum superficialis lie medial, okay, and the flexor carpi radialis muscle will lie lateral. Then what happens? Then the palmaris longus tendon will lie above. So the relationship at the distal forearm is as follows, okay? So the flexor digitorum superficialis is lying medially, okay? The flexor carpi radialis lies lateral, okay? Then it is under the cover of the palmaris longus. Very, very important, okay? So the median nerve is going to leave the wrist, to enter the hand by passing through a tunnel. And that tunnel is formed by the carpal bone and the transverse carpal ligament, otherwise called the flexor retinaculum. So the flexor retinaculum is a fibrous band that bridges the concavity of the carpal bone so that you have a tunnel, and that tunnel is called the carpal tunnel. So the median nerve is going to pass deep through the carpal tunnel or deep to the flexor retinaculum to enter the hand. Once the median nerve gets to the hand, it's going to divide into two branches. So a lateral branch and a medial branch. So the lateral branch is going to supply the thinner muscles, and for that reason it is called a recurrent branch, because it curls round the thenar eminence and supply the three thenar muscles, okay, while the medial branch is going to divide into proper digital branches. So the median nerve has all the nerve roots of the brachial plexus, because it is formed by the union of the medial root and the lateral root from their corresponding cords, okay? After this union in the axilla, it constitutes one of the what? The infraclavicular parts of the brachial plexus. And within the axilla, the median nerve lies lateral to the axillary artery. This artery is the axillary artery. It further leaves the axilla to enter the anterior compartment of the forearm and the lower border of the teres major. So at the upper part of the arm, the median nerve is going to lie lateral, but now to the brachial artery. At the mid-arm level, at the mid portion of the arm, which corresponds to the level of the insertion of coraco brachialis, what happens? The median nerve is going to cross the brachial artery from lateral to medial. So this artery right here is the brachial artery. So it's going to cross the brachial artery from lateral to medial. So the median nerve comes to lie medial to the brachial artery. And this is why it is the most medial content of the cubital fossa. So this is occurring at the mid-arm level, okay? Very, very important. So after it crosses the brachial artery from lateral to medial, to become the most medial content right here, it descends to the cubital fossa. So within the cubital fossa, the median nerve is going to exit the cubital fossa by passing between the two heads of this muscle. And this muscle is called the pronator teres. It's called the pronator teres. But however, before it passes between the two heads of pronator teres, it innervates the pronator teres muscle. So this nerve right here is called the nerve to pronator teres. The nerve to pronator teres, okay? So, and after it exits the cubital fossa, by passing between the two heads of pronator teres, it enters the anterior compartment of the forearm. Within the anterior compartment of the forearm, the median nerve lies under the cover of the flexor digitorum superficialis, in the plane between the flexor digitorum superficialis and the flexor digitorum profundus, okay? And it maintains this course under the flexor digitorum superficialis muscle down to the distal aspect of the forearm. Very, very important. So, but it supplies some muscles within the forearm, okay? And these medial branches it gave to muscles of the forearm include to the superficial flexors. So we have this, the flexor carpi radialis. Flexor carpi radialis. And this second twig is for the palmaris longus. the palmaris longus. And this third tweak is simply for the what? The flexor digitorum superficialis. So a superficial flexor of the digit. It's for the flexor digitorum superficialis. Then further down its course, on the anterior compartment of the forearm, okay, the median nerve gave a branch. And this deep branch of the median nerve is what is called the anterior interosseous nerve. So this nerve right here is called the anterior interosseous nerve. So the anterior interosseous nerve, which is this nerve right here, is the deep branch of the median nerve, okay? Usually given of why the median nerve has passed through the two heads of the pronator teres, okay? Now, this nerve called the deep branch of the median nerve or the anterior interosseous nerve, because it runs anterior to the interosseous membrane, gave rise to branches. And these branches are going to innervate the deep muscles of the anterior compartment of the forearm. And these muscles are, okay, the first is the flexor digitorum profundus. So this is the nerve to the flexor digitorum profundus. So it's a deep flexor of the digit. A very deep flexor of the digit, okay? So this nerve right here goes to the flexor pollicis longus. Flexor pollicis longus. So it is a deep muscle that flexes the pollex or the thumb, but it has a long tendon, okay? Then this third one here is for the pronator quadratus. So the deep pronator. The pronator quadratus muscle, okay? For a four-sided muscle that moves from the distal end of the radius to the distal end of the ulna and is important for deep pronation. So it's a deep pronator of the forearm, okay? All right. So these two muscles right here is an important relation, okay? So this muscle right here is known as the flexor digitorum superficialis, while this muscle is the flexor carpi radialis. So at the distal forearm, the median nerve, which is this nerve right here, lies between the flexor digitorum superficialis medially and the flexor carpi radialis laterally. Okay? So, and this is the flexor retinaculum. This is the flexor retinaculum. So the median nerve leaves the distal forearm to enter the hand by passing deep to the flexor retinaculum or through the carpal tunnel. So it passes through the carpal tunnel. Okay, but just before it passes through the carpal tunnel, it gave off a branch. And this branch of the median nerve that escapes the passage of the carpal tunnel, but rather passes above the flexor retinaculum, and it is not the content of the carpal tunnel. This branch right here is known as the palmar cutaneous branch. It's called the palmar cutaneous branch of the median nerve. So the palmar cutaneous branch of the median nerve is a branch of the median nerve that is given off in the distal aspect of the forearm, which rather passes above the flexor retinaculum. It does not follow the main stem of the median nerve to pass through the carpal tunnel, and that is hyoid, okay? So this palmar cutaneous branch of the median nerve communicates with other nerves on the anterior compartment of the forearm. And what are those nerves, okay? It communicates with the lateral cutaneous nerve of the forearm. It communicates also with the superficial radial nerve. It also communicates with the posterior cutaneous nerve of the forearm. Very, very important. And this palmar cutaneous branch is also going to innervate or give articular branches to joints. And what joint is that? Okay, it's also going to give articular branches to the distal radio-ulnar joint. Articular branches to the distal radio-ulnar joint. Okay. So Once the median nerve enters the hand, so this whole area is the hand. Once it enters the hand, the median nerve will divide at this point. The median nerve divides at this point into a lateral branch and a medial branch. The lateral branch of the median nerve that curves around the thenar eminence, this branch right here, is called the recurrent branch. So this branch is the recurrent branch of the median nerve, okay? And the recurrent branch of the median nerve, which is this nerve right here, we curve over the thenar eminence and supply the three muscles of the thenar eminence. And what are those muscles? So we have the abductor, flexor pollicis brevis, the flexor pollicis brevis. Is a short flexor of the pollex. The abductor pollicis brevis, the abductor pollicis brevis. And the last muscle is the opponens pollicis. It allows the thumb to carry out the oppositional movement. Okay? So the opponens pollicis. Alright. Why the medial branch? This medial branch will break into proper digital branches. That will join the remaining stem of the recurrent branch that will break into proper digital branches. And these digital branches altogether will be 5 digital branches. And the 5 digital branches are going to supply the lateral 3.5 digits. The lateral 3.5 digits, okay, of the hand. So the lateral 3.5 digits will be innervated by these 5 digital branches. And through this medial branch of the terminal part of the median nerve, the median nerve is also going to innervate 2 lumbricals, or the lateral 2 lumbricals are going to be innervated by the median nerve. Very, very important. All right. So this last diagram is going to tell us an overview of the innervation of the median nerve. Okay. So this diagram right here, let's look at this diagram. So it is formed by the union of the medial root. So this is the lateral root, and this is the medial root of the median nerve. So this nerve right here is the median nerve. So it's going to descend down to the arm, and it's going to lie medial to this tendon. This tendon is the biceps brachii. Also lie medial to the brachial artery. Also lie medial to the brachial artery. Alright. So within the cubital fossa, it will pass between the 2 heads of pronator teres. So it's going to give an articular branch to the elbow joint. So this is the articular branch to the elbow joint. Okay. It's going to give a branch to the palmaris longus. It's going to supply the flexor carpi radialis. It's going to supply the flexor digitorum superficialis. Okay. Down the forearm is going to supply, okay, the flexor pollicis longus to supply the pronator quadratus, then to supply the lateral half of flexor digitorum profundus. Okay, then this nerve will further descend, the main stem of the median nerve descend and passes deep to the flexor retinaculum. So this is the flexor retinaculum. But before it passes deep to the flexor retinaculum, it gave a branch that passes above the flexor retinaculum. And this branch right here is the palmar cutaneous branch of the median nerve. It's called the palmar cutaneous branch of the median nerve. It passes above the flexor retinaculum and supplies the skin over the central aspect of the palm and the skin over the terminal eminence. Very important. Okay. So why this deeper stem that passes through the carpal tunnel will divide into a lateral part and a what? And a medial part. So the lateral part will call and supply the muscles of the terminal eminence, while the medial part will divide into proper digital branches. Okay. The remainder of the lateral part that supply the terminal muscles will also divide into proper digital branches, so that at the end you're having about 5 proper digital branches that will supply the lateral 3.5 digits. It's going to innervate the lateral 3.5 digits. Okay, including their nail beds. Very, very important. So this is the distribution of the median nerve. So the median nerve also gives articular branches to joints, and those joints include, so it's going to supply the elbow joint, the proximal radioulnar joint, the distal radioulnar joint, the metacarpophalangeal joint, and the what? Interphalangeal joint that you find in the hand. The median nerve is also going to give cutaneous branches to the area over the terminal eminence, to the area over the central aspects, okay, of the palm. The median nerve also gives other branches called the vascular branches. It will give vascular branches to the brachial artery, okay, and to the radial and the ulnar arteries, respectively. So the median nerve also has a communicating branch. So that communicating branch enables it to communicate to the ulnar nerve. So the median nerve communicates to the ulnar nerve through a communicating branch, okay? And that is fascinating because there's just only one flexor here that is not innervated by the median nerve. And that flexor is called the flexor carpi ulnaris. So the flexor carpi ulnaris is only innervated by the ulnar nerve, okay? Usually, two muscle tweaks are given to the flexor carpi ulnaris, okay? 2 neurovascular pedicles are usually given to the flexor carpi ulnaris by the ulnar nerve. But the ulnar nerve communicates to the median nerve through a communicating branch. So it's important to know some of these dynamics that are actually playing on the anterior compartment of the forearm. Okay, so up next is some clinical correlates. So injury to the median nerve. So injury to the median nerve can cause paralysis of the muscle supply. Okay, flattening of the terminal eminence, and the flattening of the terminal eminence results in what is called the atrophy of the terminal eminence. So it looks like an ape's hand. So it's called the ape's hand deformity. Okay, there could be compression of the median nerve between the 2 heads of the pronator teres. Okay, so the pronation activity is actually lost. So the hand will be placed in supine position with weak flexion. Okay, what also happens when there's compression of the median nerve at the carpal tunnel? Carpal tunnel syndrome. Carpal tunnel syndrome is the commonest form of nerve entrapment. Okay, and what happens? The median nerve is trapped in that tight space between the flexor retinaculum and the carpal bone. It is trapped in that tight space by the 9 flexor tendons. So once it is trapped there, okay, the velocity of neuronal impulses is affected and altered, and it has some manifestations like pain over the area supplied by the median nerve. So there will be painful sensation in the form of pin sensations, okay, around the distribution of the median nerve. Okay, there will be further flattening of the terminal eminence to cause ape hands deformity. Okay, and what this happens, there's also going to be tingling and abnormal sensation within those distribution of the median nerve. It's also important to know that there are various causes of carpal tunnel syndrome. Okay, so it could be due to inflammation of the synovial sheaths around those tendons, like tenosynovitis, okay, of the synovial tendons. Tenosynovitis of the synovial tendons. Okay, it could be due to the gain of water and body fluid associated with pregnancy. That's another cause. It could be due to osteoarthritis, usually affecting the wrist joint. it could be idiopathic unknown, okay? It could follow some chronic diseases and some endocrine disorders has been associated with that, such as acromegaly, and Cushing's syndrome. These are some of the changes that could precipitate carpal tunnel syndrome. You can also see it in dislocation of the lunate, okay, and some serious fracture of the scaphoid. So what happens? There's a form of tension on the transverse carpal ligament. There's a pulling effect on the transverse carpal ligament. It is stretched and that concavity is reduced. So the reduction in the concavity gives only a narrow space for the transmission of the long flexor tendons. It will result to subsequent compression of the median nerve within the carpal tunnel. But guess the bad guy that escapes this? The bad guy that escapes this is simply the palmar cutaneous branch of the median nerve, because it does not follow the main stem of the median nerve to pass through the carpal tunnel. So it passes superficial to the flexor retinaculum and supplies the skin over the central aspect, okay, as well as the terminal eminence. So it is the nerve that is responsible for the maintenance of the integrity of supply, okay, on the skin over the central aspect of the palm and over the terminal eminence in carpal tunnel syndrome. So carpal tunnel syndrome is the commonest form of nerve entrapment. And there are some signs you can elicit in carpal tunnel syndrome. So we have what is called the Tinel signs, okay? So the Tinel sign and the Fanel sign. So if you're able to establish the Tinel signs and the Fanel signs, if they are positive, it gives you a pointer that this could be carpal tunnel syndrome. Thank you very much.